Glasgow City IGB and HSCP Strategic Plan 2019 to 2022. Health and social care services have been integrated in Glasgow. The Glasgow City Integration Joint Board, or IGB for short, and Health and Social Care Partnership, HSCP for short, are responsible for them. What is the strategic plan? We have an annual budget of around £1.2 billion for health and social care services in Glasgow, and one of the things we need to have is a 3-year strategic plan for our services. The IGB approved our second plan for 2019 to 2022 in March. Our first plan was for 2016 to 2019. The plan shows how the 9 national health and wellbeing outcomes for health and social care integration will be delivered locally. They focus on health and wellbeing, independent living within communities, positive experiences of services, person-centred services, health inequalities, unpaid carers, safety from harm, an engaged workforce, and effective and efficient use of our resources. How was the plan developed? We consulted on a draft version of our plan with a range of people and organisations so that they could provide feedback and inform its final development. This included patients, service users, carers, staff, third and independent sector organisations, IGB members and other stakeholders. The consultation took place from October 2018 until January 2019, and it was designed to be inclusive and supportive to increase opportunities for people to participate. Awareness-raising emails, public websites, social media and newsletter articles were used to promote the plan. Stakeholders shared their views through an online survey or by email, and we also hosted 7 events. The reach of the consultation was wide. There were 3,585 page views on our website, 1,354 downloads of the draft plan, 88 tweets and Facebook posts, which were retweeted and shared 305 times, and 12,085 views of Facebook posts on Glasgow City Council's profile. As a result, there were 429 responses to the survey and 546 people participated in our events. What is the vision for health and social care in Glasgow? Our medium to long-term vision is that the city's people can flourish with access to health and social care support when they need it, and this will be done by transforming health and social care services for better lives. We believe that stronger communities make healthier lives. Therefore, our vision can be summarised in one phrase: flourishing communities, healthier lives. What are the strategic priorities for health and social care in Glasgow? Our 5 key strategic priorities continue to be prevention, early intervention and harm reduction, providing greater self-determination and choice, shifting the balance of care, enabling independent living for longer, and public protection. What is some of the other work underway to transform health and social care services? Transformation is central to our vision for health and social care services. It is not simply about changing how they are structured, but it's about making significant changes to how they're planned and delivered in partnership, and how they are received and experienced by the people who are supported. We are committed to developing and delivering innovative services that focus on supporting people to achieve their personal outcomes and aspirations, and at the same time, it is an opportunity to deliver more efficient services. We have a transformational change programme for children's, adult and older people's services. There's also a range of other work being progressed, such as the mental health strategy and primary care strategy. What is the context of the plan? For demographics, Glasgow has a population of about 615,000 people. This is 11.4% of Scotland's population, and between 2016 and 2026, it is expected to increase by 4%, with greater growth for children at 6.3% and older people at 14.4%. Some other statistics include life expectancy for Glasgow males is 4.5 years less than their Scottish counterpart, and 3.1 years less for females. 2/5 of our population live in one of Scotland's 15% most deprived areas, and 1/3 of our adults live with a limiting long-term illness or condition similar to 32% of Scotland's adults. Equalities. When planning and designing services, we are committed to equalities and human rights legislation and meeting the requirements to eliminate unlawful discrimination, advance equality of opportunity and promote good relations. Finance and resources. The financial position for public services continues to be challenging and we estimate a gap of £100 million over the next 3 years. We have developed a financial outlook for 2019 to 2022. This provides us with an opportunity to plan services based on our total available resources and also supports a balanced budget. We will continue to work with partners to focus resources on sustainable services that are targeted to those with the greatest need. We will need to make the best use of our resources so that our services are effective and efficient, and this includes both our property and our most valuable resource, staff. What is the partnership in Glasgow City Health and Social Care Partnership? Partnership means working together. Everyone has a role and shared responsibility in the planning and delivery of services, and this includes people who are supported by them, those who plan and deliver them, or those who may have an interest in them. We will continue to support partnership working so that services reflect the priorities and needs of our local people and their communities. We will support this through the IGIB's diverse membership, our IGIB Public Engagement Committee, our locality engagement forums, our participation and engagement strategy, and our consultation and engagement opportunities. How can you find out more information? Just visit our website at www.glasgowcity.hscp.scot.